I'm now in conversation with Anthony Chang. He's based at a hospital in Orange County in California, and I'm going to do a short interview with him in preparation for the webinar on digital healthcare in the USA next week. So, Anthony, could you begin by just describing who you are and what role you play in your organization?
A practicing pediatric cardiologist, and I'm interested in artificial intelligence. So I'm the Chief Intelligence and Innovation Officer at my hospital.
Okay, and a little bit about background about yourself. How did you become involved in medicine? What kind of shape did your career take?
Well, I've always been interested in pediatric cardiology, but my interest has also been a long time in the statistics and biomedical data, and that led to myself going back to school about a decade ago to study current data science and artificial intelligence.
Oh, right. Okay. But before that, how did you get involved in medicine? Did you always want to be a doctor, or
Yes.
what kind of path did your career take?
Well, I wanted to be a pediatric cardiologist since I was about 16 years old when I heard a talk on congenital heart disease. Before that, I wanted to be an architect. So in a way, it's nature's architecture that I'm involved in. So yeah, I've been interested in going to medicine for a long time.
Okay. And where did you do your initial education then, once you decided you wanted to go into pediatric cardiology?
Went to school at Johns Hopkins in Baltimore, Maryland, and then went on to get more training in Washington, D.C., and then spent my training in congenital heart disease at the Children's Hospital of Philadelphia and then Children's Hospital in Boston.
Oh, okay. Well, we have something in common there because I am from Boston, but not Boston, Massachusetts. I'm from Boston in
Oh,
Lincolnshire. That's my origin. So,
okay.
yeah. So pediatric cardiology. It's a little bit of a specialist area, and you were inspired by a talk that you heard when you were still a teenager. Then.
That's right. I was 16 years old when I heard a talk on congenital heart disease, and that changed my life.
Yeah, well, that's very interesting. So you've been involved in the
Yeah.
profession for a little while then. You must have seen a lot of changes in the technologies that are used in pediatric cardiology. What are the most important ones from your perspective?
Well, I think the ready access to ultrasound for diagnosis, as well as the focus on congenital heart surgery and perioperative care has been, I think, come a long ways in the 30-some years I've been involved in pediatric cardiology.
So the technologies involved primarily in diagnostics, if you're talking about ultrasound, ultrasonics. What about areas like robotic surgery? Have you had any involvement in that?
Well, robotic surgery hasn't really made its way to congenital heart surgery just because the level of difficulty, I think, has really made it very, very difficult to be in that area. But I think in the future there will be some foray into robotic surgery and at least artificial intelligence augmented type of surgery in pediatric congenital heart surgery.
So with artificial intelligence, what role does AI play in pediatric cardiology?
Well, I think a complex field like pediatric cardiology actually will benefit greatly from deploying artificial intelligence, and that's from using artificial intelligence and making diagnosis of medical images that we get in pediatric cardiology to helping with decision support in complex patient scenarios, to also, I think, eventually deploying artificial intelligence in both the ICU setting as well as the operating room. So I think there's really a wealth of opportunities for artificial intelligence in congenital heart surgery and congenital heart care.
Well, I'm delighted that you're able to be a panelist on my webinar next week. We've always regarded here in the UK that the USA are leaders and pioneers in all things digital. So, you know, is that your perception in the USA? Do you think the USA are leading the field when it comes to the use of a whole range of digital technologies within the field of medicine and healthcare?
Well, I think it depends on what area. I don't think there's a international leader in this area, just like in artificial intelligence. And I think various countries, including the UK, the US, China, Australia, are all leading different sectors within that field. So I think, to me, a country leading in the technology doesn't make that country a leader if that technology is not deployed, efficiently and in a cost-efficient manner.
Can I just ask you a little bit about COVID-19 and coronavirus? I appreciate that it's primarily affecting older people and people with pre-existing medical conditions, but has it affected the work that you do that much in the USA?
Yes, we've really gone virtual in terms of delivering telehealth. I just saw about 8 patients this morning, all virtually, and they get perhaps their echocardiogram at the clinic, but we're not fully operational in terms of having patients and doctors come to the clinic. And out of respect for the virus and health, it can really affect people's lives. So, and we have a lot of high-risk patients, as you can imagine. So we've been doing most of our outpatient care in a telehealth situation, and that's, I think, worked out quite well. It's unusual for a patient and a family to, after they get used to seeing their doctor on, virtually, it's unusual for them not to be comfortable with that, and also demand that they be seen, physically in the clinic space. So I think we've come a long ways in terms of deploying telehealth because of the crisis that we're faced with.
So, do you think that this telehealth application and being able to see patients and the family remotely after COVID-19, do you think that will have a legacy and persist to a certain extent?
Yes, I think we will transition to a situation in which I think, for myself, I follow a lot of patients with chronic heart disease. I think probably a third to half will be done by telehealth, because it's much easier for some families not to travel, and we can usually, if we know the patients, it's actually quite convenient for both the doctor and the family to have a visit this way. And I think that will persist long beyond this pandemic.
Have you been doing any work with the kind of telemedicine robots that I know that we have surgeons in the UK, for example, who are using mobile robots with a little screen that effectively allow the patient, the doctor, to do his rounds in the hospital via this robot. Have you had any incidences, experience of that?
Yes, I have, but not during this pandemic. I have gone on a sort of using a robot as a virtual liaison to do rounds at a hospital, internationally. So, but not during the pandemic.
No. Okay. Well, I very much appreciate your time and your willingness to take part in the webinar next Tuesday. I just want to thank you